Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr.Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. My email is sreeklpm@gmail.com. I am also the medical author of the two books Focused Neurology and Exam Oriented Clinical Neurology. We are continuing with a series of lectures of Prime Neurology. There are going to be 50 episodes of Prime Neurology, and if one listens to all these 50 episodes of Prime Neurology, one would have acquired a good knowledge of neurology. Right now we are on part 40 Prime Neurology, CNS infections, part 5 Neurocysticercosis. So in this episode we are going to discuss Neurocysticercosis. Neurocysticercosis. This is the larval or intermediate stage of infection with the poke tapeworm Taenia solium. In Central and South America and in parts of Africa and India, cysticercosis is a leading cause of epilepsy and other neurologic disturbances. Usually, the diagnosis is suggested by CT or MRI of the brain, but can also be made the presence of multiple calcified lesions in the thigh, leg and shoulder muscles and in the cerebrum. The cerebral manifestations of cysticercosis are diverse, related to the encystment and subsequent calcification of the larvae in the cerebral parenchyma, subarachnoid space and ventricles. The lesions are most often multiple but may be solitary. Before the cyst degenerates and eventually calcifies, the CT scan and MRI may actually visualize the scolex. Most often, the neurologic disease presents with seizures. Although many patients are entirely asymptomatic, the cyst being discovered radiologically. It is only when the cyst degenerates many months or years after the initial infestation that an inflammatory and granulomatous reaction is elicited and focal symptoms arise. In some patients, a large subarachnoid or intraventricular cyst may obstruct the flow of CSF, in which case the surgical removal of the cyst or a shunt procedure becomes necessary. So these are the neuroradiological features of neurocysticercosis. Cysticercosis on CT without contrast. So we can see the multiple vesicular lesions, some with visible scoliosis and without mass effect, that is the left panel, that became calcified 2 years later, what you can see in the right panel. One important differential diagnosis of neurocysticercosis is tuberculoma. Both may present similarly. So how do we differentiate neurocysticercosis from tuberculoma? It's a very important differentiating diagnosis for neurocysticercosis. So how do we differentiate neurocysticercosis from tuberculoma? So there are about 7 features by which we can differentiate neurocysticercosis from tuberculoma. So what are these 7 features? First, the size. In neurocysticercosis, it is less than 2 centimeters, whereas in tuberculoma, it is usually more than 2 centimeters. The wall. In neurocysticercosis, the wall is well defined, thin, regular, whereas in tuberculoma, it is thick and irregular. Edema. Edema is less in neurocysticercosis but more in tuberculoma. Basal meningitis. It is less in neurocysticercosis but more in tuberculoma. Scolex. It may be present and seen in neurocysticercosis but absent in tuberculoma. There are multiple stages of neurocysticercosis, whereas the multiple stages are absent in tuberculoma. The location. In neurocysticercosis, it is usually grey white matter junction and basal ganglia, but for tuberculoma, it is posterior fossa. So a very close differential diagnosis of neurocysticercosis is tuberculoma, but we can differentiate neurocysticercosis from tuberculoma with these 7 features. What is the treatment for neurocysticercosis? Therapy of this disorder has been greatly improved in recent years by the use of CT and MRI and the administration of albendazole or praziquantel, an antihelminthic agent. Albendazole is given as 5 milligrams per kg TID for 15 to 30 days. Initially, treatment may seem to exacerbate neurologic symptoms with an increase in cells and proteins in the CSF, but then the patient improves and may become asymptomatic with a striking decrease in the size and the number of cysts on CT scanning. Corticosteroids are usually used at the onset of antihelminthic treatment, and particularly if a large single lesion is causing symptoms by its mass effect. So these are the wonderful concepts of neurocysticercosis. The other important clinical neurology concepts I put in a book called Exam Oriented Clinical Neurology, published by White Army, written by me, Dr. Sreenivas. This book will be very useful for students appearing for clinical neurology exams. If interested, this book could be purchased. The other book I've written is Focused Neurology, published by CBS Publishers and Distributors, written by me, Dr. Sreenivas. This book contains all essential elements of theoretical neurology, and this book will be very useful for students appearing for orals and viva because the concepts are given in a question and answer format. This book is available online from all leading booksellers including Amazon. So if interested, this book could be purchased online. So if you have interested these wonderful concepts of neurocysticercosis, please like and subscribe my YouTube channel. But please listen to all these 50 episodes of Prime Neurology so that one could acquire a good clinical neurology of knowledge of clinical neurology. So if you have liked this, please like, subscribe and share my YouTube channel Dr. Sreenivas Medical Concepts, which is India's leading neurology educational YouTube channel, and my web page Dr. Sreenivas Concepts. Thank you. Bye.